Patella Fracture. A 36-year-old female sustains a knee injury after falling from a ladder onto her flexed knee. The radiograph shows this injury and then which treatment is recommended. Here you see a inferior pole patella fracture with which is certainly an indication for open reduction and internal fixation. So patella fractures account for 1% of all skeletal injuries. It too is associated with an eccentric contraction. Males more commonly than females. The patella is the largest sesamoid bone in the body. As we discussed earlier, it has the thickest cartilage also, up to 10 millimeters in thickness. And the important thing to know is that the blood supply to the patella is mainly located at the inferior pole. So usually after patella fracture, the patient is unable to perform a straight leg raise, which indicates failure of the extensor mechanism. X-rays may show patella alta, and again, this is best seen on the lateral X-ray. In a child with an anterior knee injury, unable to do a straight leg raise, this is an indication for an MRI. Patella fractures can be treated non-operatively if there's an intact extensor mechanism, again, meaning that the patient can do a straight leg raise. Operative treatment is usually open reduction, internal fixation with a tension band construct. It is important to preserve the patella whenever possible. If there is extensor mechanism failure, open fractures, articular displacement greater than 2 millimeters, or displaced patella fracture greater than 3 millimeters, or a patella sleeve fracture in children, these are indications for surgical treatment with open reduction internal fixation. Standard technique would be a tension band construct. The longitudinal cannulated screws with tension bands have been shown to be the most biomechanically superior. Again, a recent article has shown that it is important to try to save the patella with open reduction internal fixation preferred over pole resection when looking at patients more than 5 years post-surgery. So save the patella if at all possible. Partial patellectomy may sometimes be indicated, but only when ORF is not possible and less than 50% of patellar height is involved. Total patellectomy is reserved for severe and extensive comminution not amenable to salvage. Again, it's important to save the patella if possible because the quadriceps loses 50% of its strength, and it is imperative that a medial lateral retinacular repair are performed if the patellectomy is performed. Again, another question on patella fracture. A 54-year-old female, 6 months after open reduction internal fixation of a patella, the most common impairment. Again, tension banding with K-wires with anterior hardware and prominent hardware, the most common finding being anterior knee pain. While all the other answers are possibilities, they are not very common. Patella fractures can have complications, could be weakness and anterior knee pain as described. Symptomatic hardware, however, is the most common, and the others listed here, same as in the question, can occur, but they don't occur very often.
If you enjoyed this video, please consider leaving a like. We'd love to hear your thoughts and what you'd like to see next in the comments. Don't forget to subscribe to our channel and follow us on social media.